Did you know hernias can run in families? If a close relative, like a parent or sibling, has had a hernia, your own risk may be significantly higher. That's because genetics can influence how certain weaknesses in the abdominal wall develop. Did you know, similarly, that men are 20 times more likely than women to develop an inguinal hernia, because men have an inherent weakness in the groin related to the movement of the testicles from the abdomen to the scrotum that occurs in the late stages of embryological development. Hi, my name is Dr. Andy Gray, and I'm a general and HPB surgeon working in Melbourne, Australia. And today I'm going to talk to you about hernias. What is a hernia? Ever noticed a strange lump in your abdomen or groin that only tends to show up when you're straining or coughing? That might be a hernia. A hernia occurs when an internal part of your abdomen, like some fat or even the intestines, pushes through a weak spot in the abdominal muscles that are normally designed to keep everything in place. A hernia will normally present as a lump, often one that can be pushed back in, but sometimes your family doctor might arrange a scan such as an ultrasound or a CT to further confirm a hernia diagnosis. Some hernias cause discomfort, whilst others can be completely pain-free. While many hernias aren't dangerous right away, they are not a problem that resolves independently, and generally hernias will slowly get bigger until such time as a surgeon performs a repair. Where can a hernia occur? The hernia can be classified as primary, when the hernia occurs with no history of prior surgical intervention, incisional, when the hernia does occur at the site of a previous operation, and recurrent, when the hernia occurs through the site of a previous hernia repair. Primary hernias tend to occur in sites of natural weakness in the abdominal wall muscles, such as in the groin, where either inguinal or femoral hernias occur, or around the belly button, where umbilical or paraumbilical hernias occur. Rarer primary hernia sites include Spigelian hernias that occur in the lower abdomen on either side above the level of the groin, and epigastric hernias that occur in the midline above the belly button. Incisional hernias can occur at any site where a cut has been made on the abdomen to perform a previous surgery. In general terms, the bigger the incision, the bigger the risk of an incisional hernia developing at that site in the future. Can complications occur? Yes. Although many patients will seek a medical opinion about their hernia before complications occur, underlying the justification to repair any hernia is the risk that the hernia could become incarcerated or stuck. This means the hernia becomes acutely painful, more swollen, and is no longer able to be pushed back in. This is a surgical emergency, as the contents of the hernia may be starved of blood supply. If this continues without an urgent hernia repair, then in the worst cases, whatever contents are in the hernia could die. What are the treatment options? Well, when it comes to treating a hernia, the main option is surgery, because as I said before, hernias usually don't heal independently. Sometimes, if a hernia is small and not causing any symptoms, advice might be given to delay repair until symptoms develop. But if it's painful or growing, surgery is usually the safest long-term solution to fixing a hernia. There are two main approaches to surgical repair: open surgery, where the surgeon makes a larger incision over the hernia in order to repair it, and minimally invasive surgery, where small cuts and a camera, either with laparoscopy or a robotic platform, are used to repair the hernia with minimal surgical insult. This in turn may have other benefits such as decreasing some operative risks and improving patient recovery. In both cases, a mesh is often used to strengthen the area of repair and prevent the hernia from coming back. Although mesh implants have had some negative press, largely this has come from their use in other anatomical locations. Surgical mesh in the abdominal wall has been safely used for over 50 years and is seen as the gold standard for a long-lasting hernia repair.